In this podcast episode, Calley Means, a health advocate and co-founder of TrueMed, shares his insights on the systemic issues plaguing modern healthcare. He discusses the economic incentives that prioritize chronic illness over wellness, the role of insurance and pharmaceutical companies, the impact of diet and environmental factors on public health, and the urgent need for holistic approaches to health and wellness. Through his advocacy, Means emphasizes the importance of addressing root causes rather than merely treating symptoms, particularly in the context of rising childhood obesity and infertility crises. Calley Means highlights the fundamental economic incentives that plague the modern healthcare system, arguing that these incentives lead to a focus on managing sickness rather than promoting health. He emphasizes that every aspect of healthcare, from insurance companies to pharmaceutical firms and hospitals, is structured to profit from chronic illness rather than wellness. This systemic issue creates a cycle where the focus is on treatment rather than prevention, ultimately exacerbating public health crises. Means begins his critique with the insurance industry, particularly in the context of the Affordable Care Act, Obamacare. He explains that the law established a 15% medical loss ratio, which allows insurance companies to keep only 15% of premiums as profit. This structure incentivizes insurers to raise premiums to maintain their profit margins, leading to higher healthcare costs. As a result, more individuals become sick and require treatment, creating a financial motive for insurance companies to allow escalating healthcare costs. Since the implementation of Obamacare, premiums have doubled, making healthcare a significant driver of inflation. Shifting focus to pharmaceutical companies, Means points out that 95% of medical spending is directed toward chronic disease treatments. These companies benefit from patients who require lifelong management of conditions such as heart disease, diabetes, and cancer, which represent recurring revenue streams. Means argues that the pharmaceutical industry is not incentivized to find cures, but rather to keep patients on medications indefinitely, as this is economically advantageous for them. This profit-driven model perpetuates a cycle of chronic illness, as patients remain dependent on medications rather than receiving holistic care that addresses the root causes of their conditions. Means also critiques the hospital system, stating that hospitals are primarily incentivized to perform interventions and procedures. Hospital administrators are often evaluated based on the number of beds filled and interventions performed, leading to a focus on surgeries and treatments rather than preventative care. He shares an anecdote about his sister, a surgical resident, who observed that many patients undergoing surgeries for chronic conditions were not being asked about the underlying causes of their illnesses, such as diet and lifestyle. This lack of inquiry into root causes further perpetuates the cycle of chronic disease. The conversation then shifts to the broader implications of these systemic issues, particularly concerning children. Means points out that childhood obesity and chronic diseases are on the rise, with alarming statistics showing that a significant percentage of children are overweight or obese. He argues that this is not merely a matter of personal responsibility, but rather a reflection of systemic failures in the healthcare and food industries. The medical system often fails to address the root causes of these conditions, focusing instead on treating symptoms. Means defines chronic disease as conditions that do not pose an immediate threat to life, but require ongoing management. He explains that chronic inflammation is a significant contributor to many health issues, driven by environmental factors, diet, and lifestyle choices. The American diet, heavily reliant on ultra-processed foods, is a primary driver of chronic inflammation and metabolic dysfunction. This dietary pattern is particularly concerning for children, as it sets the stage for lifelong health issues. Means highlights the challenges faced by low-income households in accessing healthy food options. He argues that the current food system is designed in a way that makes it difficult for these families to afford nutritious food. Instead, they often resort to cheaper processed foods that are high in sugar and unhealthy fats, leading to a cycle of poor health outcomes. This situation is not a free market issue, but rather a failure of public policy that neglects the health of vulnerable populations. The systemic issues in food accessibility contribute to rising rates of obesity and related health problems among low-income individuals. Means discusses the impact of American food ingredients on gut health, particularly the prevalence of additives and preservatives that are not found in foods from other countries, such as those in Europe. He shares personal experiences of health issues related to gut dysbiosis, including SIBO and H. pylori, which he attributes to the differences in food quality and ingredients. Many processed foods in the U.S. contain harmful substances that disrupt gut health, leading to chronic inflammation and other health problems. This situation is exacerbated by the lack of regulation on food ingredients, which allows companies to prioritize profit over consumer health. The conversation shifts to environmental toxins, particularly in water and air. Means references the Environmental Working Group database, which allows individuals to check the quality of their local water supply. He expresses skepticism about the government's ability to ensure clean water and air, citing the prevalence of toxic substances that can harm public health. The current state of environmental health is a disaster, with many people unaware of the dangers posed by pollutants in their surroundings. Means calls for urgent action to address these issues, as they significantly impact overall health and well-being. Means critiques recent studies suggesting that excessive exercise can be harmful, particularly for older adults. He argues that this perspective is misguided and reflects a broader misunderstanding of the importance of physical activity for health. Regular exercise is crucial for preventing chronic diseases and maintaining overall health. Means believes that the medical community has failed to adequately promote exercise as a fundamental aspect of health, instead focusing on pharmaceutical solutions. He advocates for a cultural shift that prioritizes movement and physical fitness as essential components of a healthy lifestyle. The discussion turns to Ozempic, a medication used for weight loss and diabetes management. Means expresses concern about the implications of widespread use of this drug, particularly its potential side effects and the way it addresses symptoms rather than root causes of obesity. While Ozempic may provide short-term weight loss benefits, it does not address the underlying issues related to diet and lifestyle that contribute to obesity. Means is skeptical about the long-term effectiveness of relying on such medications, advocating instead for a focus on holistic health approaches that include dietary changes and lifestyle modifications. Means delves into the infertility crisis in the U.S., linking it to broader health issues stemming from poor diet and environmental factors. He discusses how conditions like polycystic ovarian syndrome are often treated with medications rather than addressing the underlying metabolic dysfunction. The infertility industry prioritizes profitable interventions like IVF without adequately educating patients about the lifestyle changes that could improve their fertility. Means argues for a paradigm shift in how infertility is approached, emphasizing the importance of understanding the metabolic ties to reproductive health and advocating for dietary interventions as a first step before resorting to invasive procedures. Calley explains TrueMed as a health advocacy platform aimed at addressing root causes of health issues rather than merely treating symptoms. The platform encourages individuals to utilize their health savings accounts and flexible spending accounts to seek out medical advice that focuses on underlying health problems. TrueMed aims to empower patients to demand more from their healthcare providers, advocating for a shift towards a more holistic understanding of health that prioritizes prevention and lifestyle changes over pharmaceutical interventions. Calley reflects on the partnership between President Trump and RFK Jr., emphasizing a shared desire for unity in addressing critical health issues facing the nation. He recounts a moment of connection he felt after witnessing an assassination attempt on Trump, which prompted him to reach out to RFK Jr. Their discussion centered on the importance of focusing on the health crisis in America, particularly concerning childhood obesity and diabetes. Calley notes that their conversations were filled with genuine concern rather than political maneuvering, highlighting a collective commitment to improving the health of children in the U.S. Calley expresses deep concern about the trajectory of American health over the next several decades. He cites alarming statistics about obesity and diabetes, predicting that if current trends continue, the U.S. could face a significant health crisis that would destabilize society. He warns that the agricultural system is unsustainable, with soil degradation and a reliance on processed foods leading to widespread health issues. The current healthcare model, which profits from chronic illness, poses an existential threat to the nation. Means emphasizes the need for immediate action to address these systemic problems, advocating for a shift towards regenerative farming and holistic health practices. Calley draws parallels between the health crisis and the climate debate, suggesting that both issues stem from a disconnect between human activity and natural systems. He critiques the pharmaceutical and climate industrial complexes, arguing that both are driven by short-term interests that neglect long-term sustainability. Just as the climate movement seeks to address environmental degradation, the health movement must focus on restoring balance to human health and the food system. Calley advocates for a collaborative approach that integrates environmental and health agendas, emphasizing the importance of respecting natural cycles in both agriculture and personal health. When asked about reliable sources of health information, Calley shares his personal journey of discovery through books and podcasts. He highlights the importance of independent media in providing accessible and accurate health information, contrasting it with mainstream media's often narrow focus. Influential authors and experts, such as Mark Hyman and Robert Lustig, have shaped his understanding of metabolic health and the systemic issues within the healthcare system. Calley encourages listeners to seek out diverse perspectives and engage with content that challenges conventional wisdom, emphasizing the value of community and shared knowledge in navigating health challenges.